Hey, Mark, good morning. Well, the state of Texas specifically is going to get over $281 million in 2026 to help improve rural health care. And what the Trump administration is wanting states to do is really to improve it across the board, trying to stop rural residents from having to drive hours and hours just to get basic health care. So the Trump administration is wanting states to use this money to improve preventative care, primary care, maternal health care, behavioral health services, also on the list of what the Trump administration wants to improve. But it's not just about improving it. It's about making them more efficient, making them more sustainable, and leaning into new technology. Think about things and try to think outside of the box. What could we do today that we couldn't have even thought about 10 years ago or 20 years ago? How can we use the technology that we have today in order to improve that access? The Trump administration really wanting innovation. They don't want states just leaning into what they've always done to try to, patch the problem or try to improve rural health care. They really want states to be thinking outside the box, and that's something that Dr. Oz, the administrator for the Centers for Medicaid and Medicare Services, really stressed in a conversation with Scripps News.
We want the money to be used to change the way we envision healthcare in rural America, not just to pay bills on programs getting created 60, 70 years ago that don't seem to be working. And by doing this the right way and by allowing more practitioners to move to these areas, training nurses and doctors in these rural areas, we think they'll stay put and provide high quality care.
An example of that innovation that the Trump administration is looking for is the state of Alaska. Part of what they're going to be using this funding for is to start a program using drones to deliver medications to parts of the state that are harder to access. So this $50 billion will be distributed over the next 5 years. It's $10 billion every year. And this healthcare money, while the amounts were doled out and announced yesterday, this money was actually part of the Trump tax bill that the president signed back on July 4th. And adding this rural health care fund was part of what needed to happen to get the vote and support of some key moderate Republicans in the Senate, Senators Susan Collins from Maine and Senator Lisa Murkowski from Alaska. So this $281 billion that Texas is set to get in 2026 is just going to be the beginning of a massive investment in trying to improve rural health care, Mark.